going to do a 360 of the room. This is my ID. My name is Jeremy Aguirre. This is Jeremy Aguiar. So I'm going to sanitize my hands. Put on gloves. Put down the stethoscope. The sterile wipe. Check the patient's ID band. Perfect. You say your name and date of birth. Great. My name is Jeremy. I'll be your student nurse today. I'm just going to do a physical assessment on you if that's okay. Great. Do you have to go to the washroom before you go? No? Great. I'm just going to put this curtain up. So, how are you feeling? Are you comfortable? Great. I'm going to start now. So, the patient, to start off with the physical assessment, the patient seems to be the stated age, and the patient's skin tone is equal throughout the body. Moving on to the patient's body structure. The patient's body structure is equal bilaterally in size, and there are no obvious physical deformities on the patient's body. The patient's posture is nice and erect. He is comfortable sitting with his arms in that position, and his shoulders are relaxed. Moving on, the behavioral, the patient is able to maintain eye contact with me and is able to speak clearly and is able to understand me. His facial structures are normal for the situation. He is dressed appropriately for the weather and his clothes are clean and there's nothing wrong. Moving on to gait, can you please stand up for me, move towards me, and now go back. For gait, the patient was able to have a steady and even movement. His arms swung symmetrically for range of motion. And can you please flex your arms for me? Great, and extend them. Perfect. The movements were smooth, moving and deliberate. Moving on. Checking the patient's breathing. The patient's breathing effortlessly and there's no signs of distress. Next, I'm going to check for the level of consciousness. Do you know who you are, where you are, and what time it is? Perfect. The patient answered all three of my questions correctly, meaning the patient is oriented. Now I'm going to check your head. Is that okay? On inspection of the head is midline and in the center of the body. Upon palpation of the skull, the skull is symmetrical and smooth. Do you feel any pain? There is no tenderness, there is no masses, and no swelling. Moving on to the hair, the patient has a full set of hair, and the texture of the hair is smooth and black. The color is black. Now I'm going to assess your facial features. Upon assessing the patient's facial structure, it is symmetrical with no involuntary movements. Upon palpation, there are no masses. Do you feel any pain? There is no pain, there is no tenderness. Perfect. The patient's temperature is normal. Moving on, I'm going to check your cranial nerve number 7. Can you please smile for me? Oh, sorry, which is the facial nerve. Can you please smile for me? Thank you. Frown. Can you please show me your teeth? Thank you. Can you please close your eyes tightly? Can you please puff out your cheeks? And can you please raise your eyebrows? Great. Cranial nerve number 7 is intact and is all symmetrical. Moving on, I'm going to examine your eyes. Looking at your eyes, your eyebrows are symmetrical. There is no crossing on the eyes. Can you please close and open your eyes? Great. There is no lid lag. and there's even less distribution. Now I'm going to check for your cranial nerve number 3, which is your oculomotor nerve. The pupil size is 4 milliliters and it is even on the other side. The shape of the pupil is round and symmetrical. I'm now going to assess the direct and incentral light reflex. Using my pen light from one side to the middle and the other side to the middle. The patient's direct light reflex is when the light is shined on the patient's eyes and the pupil constraints, which happened on this patient. Now I'm going to test for accommodations. Can you please see at the tip of this pen? Perfect. The patient's pupils dilated. As I move closer to the patient, the pupils constrict. The pupils converge. Which means cranial nerve number 3 is intact. Moving on, I'm going to inspect your ears. They are symmetrical and even bilaterally. There's no discharge, as I can see. Now I'm going to palpate your auricles. I'm going to palpate your auricles. There is no tenderness. Okay, now I'm going to perform the whisper test. He was able to respond back to me with the correct names. And he did it again. He was able to respond with the correct words that I said on both ears. Now I'm going to inspect your nose. Inspecting your nose, it is midline and there is no discharge. I'm going to palpate your frontal sinuses and your maxillary sinuses. Do you feel any pain? The patient feels no pain and there is no tenderness. I'm going to inspect your mouth. Starting off with your lips. They're hydrated and there is no swelling. Can you open your mouth for me, please? Thank you. The gums are pink and there is no bleeding. The teeth are evenly distributed and there is no signs of looseness. The tongue is symmetrical and hydrated. Can you touch the tip of your tongue with the roof of your mouth? Thank you. The base of the tongue is hydrated and there is no lesions. Moving on, can you please relax your tongue for me? Thank you. Can you please open your mouth? The soft and hard palate are intact with no lesions. Now I'm going to test cranial nerve number 9 and 10. Can you open your mouth, please? And say, ah. Perfect. Can you close your mouth? The patient was able to say ah, and the uvula and soft palate moved up and back, meaning the cranial nerve number 9 and 10 are intact. Now I'm going to test cranial nerve number 12. Can you please stick your tongue out? The tongue is midline. Can you move your tongue to side? Can you please now say light, tight, and dynamite? The patient was able to say light, tight, dynamite, meaning the cranial nerve number 12 is intact. Moving on, I'll be palpating, inspecting your neck. The head position is midline and it is centered. There is no scars, no lesions. The skin color is even with the background of the patient, and there is no visible masses. Now I'm going to palpate your carotid arteries. The grade strength is +2. The rhythm is regular. And now I'm going to check the other side. And it is equal bilaterally on both sides. Now I'm going to test your cranial nerve number 11, which is your spinal accessory. Now I'd like you to rotate your head from one side to the other while I add resistance. Great, perfect. Now can you shrug your shoulders? Perfect. Cranial nerve number 11 is intact. Moving on, I'll be inspecting your upper extremities. There's no involuntary movements, there's no lesions, no scarring, nor deformities. And the pigmentation is even on the skin. Moving on, I'll be palpating your arms. Is there any tenderness? There is no masses, no lesions, and the temperature is warm. The skin is consistent with the patient's background, and now I'm going to check your fingernails. The fingernails are curved and smooth with no lesions. They're pink in color and clear, and I'm gonna squeeze your finger. The clear capillary are even. Moving on. I would like to test your range of motion. Can you please stand up for me? Perfect. Can you copy my actions? I'm now going to start doing the actions. Can you please flex your fingers for me? Extend them. Can you flex your wrist? Now extend it. Can you move your wrist radial and your lateral? Can you flex your elbows for me? Perfect, and extend them. Moving on. Can you move your arms to supination? And now can you do pronation? Perfect. Can you shrug your shoulders? And perform abduction and adduction. Moving on. Can you do internal rotation? And finally external rotation. Great. Now, I observed there was no pain and there was no altered range of motion. Moving on to assessing for radial pulses. Checking both at the same time after 1 minute. It is 80 beats per minute. And the rhythm is strong with a pulse rate of 2 plus 2. Moving on, I'm going to test your grip strength. Can you please squeeze my fingers for me? Perfect. It is strong and symmetrical bilaterally. Now I'm going to inspect your lower extremities. Thank you. There are no lesions, no scars, and no involuntary movements. The skin is even throughout. Great. Upon palpation, the temperature is warm. Do you feel any pain? There's no tenderness, and there is no swelling or masses. Great. Now I'm going to assess your tibial pulse, both at the same time for 1 minute. The pulse is 80 beats per minute. And the rhythm is strong, and the pulse strength is +1, and is equal bilaterally. Moving on, I'm going to assess the dorsal flexion of the foot, and now plantar flexion, just down. So can you please dorsal flex for me? Perfect, and plantar flex for me. Great. I'm now going to re-sanitize my hands. Moving on, I'm going to assess your posterior thorax. So I'm going to move the patient to his back first. Now I'm going to assess the patient. The posterior thorax is midline and is symmetrical. There's no lesions or scars. Great. Moving on. Upon palpation, there are no masses or lesions, and there's no tenderness, and the temperature is normal. I'm now going to osculate the posterior thorax. For breath sounds, please breathe in and out, and 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 in and out. Great. There is no crackling or wheezing, which is normal, which means the lungs are clear. Moving on. Now I'm going to assess the breathing rate of the patient. Flip it back. Assessing the breathing rate of the patient. The patient breathes 18 breaths per minute. The chest is expanding symmetrically. Moving on, I'm going to listen for your heart. Oh, first, it is one. The patient's is 1 or 2 to 1. Moving on, I'm going to assess the patient's cardiovascular. To assess the patient's cardiovascular, I'm going to listen to your heart sounds. Starting with your intercostal space, which is your aortic valve. Yeah, your second left intercostal space, which is your Newtic valve. Moving on to your third left intercostal space, which is your Erb's point. Now your fifth left intercostal space, which is your tricuspid valve. Perfect. And finally, the fifth intercostal space, which is at the left mid timicular line, which is your mitral valve. Perfect. The patient is so the patient's S1 and S2 sounds are heard best. Sorry, the patient's S1 sound is best heard at the apex of the heart, which is near the tricuspid valve and the mitral valve. Moving on, the S2 is heard best at the base of the heart, which is near the aortic valve and the monic valve. I am assessing the patient's pulse rate. The pulse is 80 beats per minute. It is strong and there's no extra heart sounds, which is a good sign. Now I'm going to check your abdomen. Please raise your shirt. And might help you lie down, and I'm going to cover you. Can you please raise you down for me? Thank you. Assessing the abdomen. The umbilica is midline and inwards to the abdomen. It is symmetrical bilaterally. There's no lesions or scars of the abdomen, and there are no visible veins of the abdomen. Moving on, I'm now going to osculate for bowel sounds. in the 4 quadrants, starting off with the right lower quadrant, the right upper quadrant, left lower, and now the left upper. The patient's bowel sounds are hyperactive. I do not hear, and I hear some clicks and some gurgling, which is normal. Moving on, I'm going to palpate your quadrant, starting with your right lower quadrant. Do you feel pain? No masses. Moving on to your your upper left. Do you feel any pain? No masses. Moving on to your lower right. Do you feel any pain? No masses. Finally moving up to your upper right. Do you feel any pain? No masses. Great. Moving on, I'm going to palpate your bladder. There is no pain and it is full. Great.